So tell us about your story. How did you both meet? And I understand you're from New York, so how did you end up in Texas?
So Rahul and I met in our second year in medical school, and we then trained together at the North Shore Hospital System in Forest Hills, New York. At which point we got married about 2 years later, and then pursued fellowship training. He did his fellowship in New Jersey, I did mine in Texas, at which point an opportunity for private practice came about. We wanted to move to the South, and this was a good opportunity for us to be in private practice together, so here we are.
Are you happy?
Yes,
Yeah, you like it?
Initially, we weren't sure if we'd like it or not, and for a while we struggled
Yeah.
with the decision, like, did we do the right thing?
Yeah.
We had very little family here, it was a new place. So it was a little bit scary at first, but now we're really happy we made the transition down here.
Good. Welcome. We are glad you're here.
Well, thank you.
Do you both speak any other languages besides English?
Yes, I speak Gujarati, Hindi, Swahili, and I'm partially fluent in Spanish.
I just speak Hindi and a little bit of Spanish, yeah, I'm not...
Well, that's still 3 languages, so that's very impressive. So, most of the people don't know what podiatrist is, so could you please explain us what podiatrists mean and when should people consult podiatrists?
Right. A lot of people don't know what a podiatrist is or what we do, but essentially we treat conditions of the foot and ankle, including ingrown nails, foot and ankle fractures. We work with a lot of diabetic patients, so we treat diabetic neuropathy, other complications of diabetes, and we work with other specialist management teams to make sure that the disease process is seen to completion and the patient is treated thoroughly. We function very similarly to orthopedic surgeons in the regard that we do treat foot deformities, including childhood deformities, as well as the trauma and fractures that we mentioned before.
So you're basically a specialist in foot and ankle. So most people, if they have foot problem, they'll go to orthopedists, but they should rather come to you because you are a specialist and you understand it a lot more in detail. So if anybody has deformity or foot pain or complications from diabetes that affects the foot and ankle, they should come and see podiatrist rather than an orthopedist. That would be a better management.
We think so. I think foot and ankle orthopods do a lot of what we do, but they also don't do a lot of what we do. We do focus our treatment options on conservative and surgical measures, but we also try to find out why are you having foot pain. We don't just focus on the foot itself. We try to focus on the biomechanical etiology, superstructures that might be causing this type of pain.
Awesome.
So you try to find the root cause of the problem.
Yes, absolutely. And as you mentioned, there is a lot of overlap between podiatry and orthopedics, but the things like treating complications of diabetes, treating forefoot specific conditions like neuromas, ingrown toenails, a lot of that won't be done in an orthopedic office. So if there's any doubt about that, again, one can just ask us directly.
Yeah.
Or inquire through our website.
Yeah, and save time because if they directly come to you, it just saves time and suffering unnecessarily and delay the process of healing.
Mm-hmm.
So that's great. Good to know the difference.
Yes.
A word of, I would recommend actually that anybody that does have a foot problem can contact our office first before heading to an emergency room, for example.
Oh yeah.
That way they will save themselves not just a great deal of time, but
expenses
as well, because a lot of times what we see is that patients that are referred to us from the ER are, they wait hours and hours to see somebody, and the patient ends up referring them to a specialist anyway, so we could just cut out the middleman and they could come to us directly.
Yeah. That's good to know. Thank you.
Certain pathologies that he's referring to are, your heel pain, your ankle sprains, your fractures, your ingrown nails, foot infections. A lot of them can be treated in our office in a matter of an hour.
Okay. Good to know. Thank you. I think a lot of people wonder if foot pain is normal and is there anything they need to do if they have feet pain?
I wouldn't say there's any such thing as foot pain should not be normal. But it's surprising how many people experience it considering the type of shoes we wear, for example. The feet are often neglected, and as podiatrists we like to make people aware of common foot conditions and ways to treat them. Injury, overuse, tendinitis, like inflammatory conditions, these are common things that afflict the feet. So So we treat.
Yeah.
So pain is not normal.
Pain is
Should not be normal, no.
should not be normal,
Yeah.
and it should be kind of investigated. Like, why is it? Why is it happening? And all it honestly takes is an appointment with a quick set of X-rays and evaluation, just to find out what is the cause of the pain.
Mm-hmm.
And we pride ourselves actually in taking a proper history and physical examination. We don't try to rush you out of it. We try to spend time with each individual patient, each unique, each patient, each condition is unique. So we try to give that the appropriate attention with great detail.
That's amazing because as a clinician, I value that a lot. That if you don't know the history, you can't get to the root cause of the problem. So
Right.
a lot of clinics, patients are in and out in 10 minutes. And to me, I don't even know how you found out all the information in
Right,
10 minutes.
right.
So that's great that you take time and care about your patients. So if somebody has pain in their arches of their feet, what does it mean? And is it something concerning?
So generally there's several reasons why one can have pain in the arches of the feet. The two main causes are plantar fasciitis, which is an inflammation of the ligament in the heel, and a tendonitis due to a flat foot. So those are the two most common reasons we see why there's pain in the arch. Treatments consist of, pain medication and/or arch supports, just to change the pressure points when they're walking, which can alleviate a lot of their pain.
Okay.
I would say the same thing. Plantar fasciitis is the one condition that kind of creeps up on you. It's brought on slowly, and people often don't understand, why they're experiencing that. They deny trauma, and they're still wondering. So often, just something as simple as just making modifications in shoes using basic inserts can just make a difference.
What is a bunion, and how can people avoid surgery for bunions?
So a bunion is also known as hallux valgus in medical terms. It is the bony prominence or the bump that most patients describe as on the inside of their foot around the big toe. Generally, treatment options include anti-inflammatories, which is medication, a good insert, sometimes injections and padding, and/or shoe modifications. If identified early, these conditions, we can try to help prevent progression of deformity using inserts. So early treatment will kind of help avoid surgery if possible.
Early detection and management is key, in my opinion. A lot of people come to us already when the bunion has developed, and they say, "Can you get rid of that?"
Right.
And in short, the answer is, not immediately.
Right.
We can, by the conservative measures at that point, can prevent the bunion from getting worse. But if a bunion has already progressed to a certain level, sometimes surgery is required at that point, especially if the pain is severe.
So prevention is better than cure.
Absolutely.
If something is bothering them, they should at least get it checked
If
rather
some-
than wait.
If something has bothered them or they see some sort of irregularity, something that doesn't feel right,
Right.
that's a good idea to come in for a screening.
Right. Because they can manage it much easily in the beginning.
Right.
Versus it's
Right.
full-fledged now, and then
That's
you're
much-
trying to
yeah.
manage it at that point.
Right, and not every bunion is needs surgical
Surgery.
management. If it affects your activities of daily living, you can't wear the shoes that you normally wear to work, and you can't function and play with your children because of it, then that is something where surgery is warranted.
Okay, good to know. And why is it important for people with diabetes to get their feet treatment with a podiatrist?
Well, diabetes is a multi system disease that for us as podiatrists, we notice it affects the nervous system, the vascular system, your blood, the flow of the inflow and the outflow of your blood from organs. So we recommend that people with diabetes see a podiatrist at least every 6 months to a year. Some of our patients with severe diabetes who have severe nerve problems like numbness in their feet, exactly, not diabetic neuropathy, which can be numbness in the feet or just extreme pain in the feet. They see us on a more regular basis, like every 3 months or so.
And I think people who have those extreme conditions, they are more aware about it than the ones who don't have major problems, and they
Right.
tend to ignore their health minor problems more than the ones with extreme because they are more cautious about anything that happens.
Right, and diabetes, like you said, does affect the nerves and the circulation of the feet. So especially in the South Asian population, you know, we see a lot of diabetic patients, a lot of patients with high blood pressure and bad circulation. We see them in our office every day, and some of them don't even know it. So if you are diabetic, you have circulation problems, and you don't know it, or you have foot pain or numbness or tingling, you should see a podiatrist.
My recommendation would be to someone with diabetes who has numbness in both feet. At that point, the neuropathy has advanced. It's very severe at that point. I would just strongly encourage people to do daily foot checks. I'll give you an example. When I was a resident, I had a patient that came in, didn't know why they were coming in. They had been brought in by a family member. The foot was 2 times its normal size.
Oh my God.
And when we performed the examination on him, we saw a needle that had been stuck in his foot and was contributing to a slow infection, which was basically rotting the foot from the inside.
Yeah.
And the patient had to be taken to emergency that day, and we were able to save a portion of his foot, but somebody else might not be so lucky.
Right. So prevention is better than
Absolutely,
cure.
yeah.
If something is wrong, something doesn't look right, get it checked rather than wait for it to get better on its own, because a lot of time it doesn't, especially if you have high blood pressure and diabetes.
Right. If you have a wound to your foot as a diabetic and you have poor circulation, that wound will never get the blood it needs to heal. So,
Yeah, I tell my patients all the time, if they tell me during the history that they have diabetes, I educate them on foot care and making sure if something is not right, or if they mention it to me, I actually send them to podiatrist, because it's so important for them to take care of their feet, because that's where it's most ignored area. We look at our face every day, we don't look at our feet every day. So okay.
Many of the patients that we receive are, they're from PCP referring primary care doctors. But of a lot of our patients that see us, our advertisements online come in, a lot of them don't have primary care doctors, So if a patient comes in, they might have just came in because they had diabetes and wanted a checkup. If we notice a vascular condition or a nerve condition, we'll make the appropriate referral to one of our colleagues to make sure that every system is appropriately being addressed. Exactly, and eventually working.
And that can prevent future kidney problems and all that.
Kidney, eyes, and
multi-organ complications. Exactly.
Is it more expensive to see a podiatrist as compared to seeing somebody, a regular physician or orthopedist?
I would say it's no more expensive than seeing any other specialist, including orthopedic surgeon. We just ask that the patient pay their copay at the time of visit, and we do have a self-pay schedule for those who don't have insurance. We take most major insurances though. Yeah.
So you are in network, you are the provider for most of the insurances, and you work with people who don't have insurance and give them some self-pay options.
Yes, we do have a self-pay option available for all patients.
Okay.
If needed, they can call the office to inquire and we can help them out.
And you can give them some idea of what the expenses will be beforehand.
Yes, our staff can give them, based on their symptoms, can give them an estimate of what their visit will be with us. Yes.
Okay. Good to know. And do you have any tips for people, for our listeners, when they're going for shoe shopping, what should they look for? What are the good shoes and what are signs of bad shoes?
Well, I think it also matters with what their foot type is, and a lot of people don't know what their foot type is, but when you have flat feet, you really shouldn't be wearing flat shoes. You're making the condition worse, or you're exacerbating your symptoms. You want to find a shoe that has an arch, or a 2 to 1 heel ratio. The heel of the shoe should be about 2 times the height of the front of it, just so that you support the arch. That's for a patient with a flat foot. Now, there are a lot of patients, especially in the South Asian community, we see with hammer toes or bunions, and their feet look like this, and they're wearing narrow, pointed shoes. That's not a recommended type of shoe for you, just because it's going to cause a lot of rub on the feet and can cause blisters, especially in the diabetic population. An ill-fitting shoe in a diabetic patient can cause a lot of wounds and complications, blisters, and infections. So I guess as a general statement, if you do have bunions, hammer toes, a wide foot, wear a wide shoe. And if you have a flat foot, don't wear a flat shoe. It really depends on the type of foot structure and or symptoms that you're having. And one thing I do see is if you're playing sports, wear a tennis shoe, don't wear a sandal. And avoid wearing, walking barefoot if you're diabetic. You really should, especially if you have neuropathy.
Or walking long distances in sandals, like for long after dinner walks, as we often see in the Indian community.
Yeah. Slippers.
Slippers.
Yes.
Yeah, sometimes
Slippers,
not even well padded slippers.
Exactly. Just flip-flops.
Exactly.
Yeah.
Exactly.
Correct.
No,
No support. They're not giving you any support, especially for long walks.
Right.
We do see that a lot. not only does it cause, musculoskeletal pain issues, but skin issues.
Yeah.
We see a lot of patients who come in with foreign bodies in their feet, dry skin,
Oh my God.
athlete's foot, because they were wearing open toes for an occasion they should not have been.
Right.
So I think a lot of these can easily be prevented.
So if they're going to be active, athletic, go for walks or play tennis or something, wear good sport shoes, walking shoes, whatever is appropriate, and just avoid flip-flops as much as possible.
If you can, yes.
Yes.
If you're not going to the pool, yes.
Right, exactly, or beach.
Exactly.
And what did you mean by white shoes? Like, is it white toe box? Like, can you explain? Because I
Right.
think people will be confused what you mean.
So by a wide shoe, we mean the width of the shoe. If you stand up, your foot is not the same when you're sitting versus when you're standing. So when you stand up and your foot flattens out and becomes wider, you need a shoe that's wider this way.
In the front.
And exactly, wider
Yeah.
in the front and a higher toe box,
Mhm.
which is the distance between the bottom of the shoe and the top of the shoe, so you can accommodate for a hammer toe or a bunion so that you don't have rub across the top of your toes.
Okay.
So you want a wide shoe which goes from big toe to fifth toe, and then you want a high shoe or a high toe box to prevent rubbing against the top of your toes.
Yeah, it's that forefoot width that's the most concerning. And then those are the most common types of pathology that we see: bunions, hammer toes. So very tight shoes in the forefoot area.
Right.
Just make those symptoms
Conditions,
worse.
yeah.
Won't make those conditions
Yeah.
worse.
Mm-hmm.
Good to know. Thank you so much for sharing
Thank
all
you.
this knowledge. That's actually very valuable for our listeners. And thank you for joining us today. We are with Dr. Jarna and Dr. Rahul from Apple Podiatry in Arlington. Thank you.
Thank
you.
you. Thank you.
If you want to learn more about Dr. Jarna and Dr. Rahul, please visit their website www.applepodiatrygroup.com. Their clinic is located in Arlington, Texas. It's called Apple Podiatry, and they have another location in Irving as well. Thank you.